Ladies and gentlemen, thank you for standing by. Welcome to the webinar for the Care Transition Toolkit for persons with mental health co-occurring conditions. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Instructions will be given at that time. If you should require assistance during the call, please press star then 0. This call is being recorded. I would now like to turn the webinar over to Erica Robbins. Please go ahead.
Thank you. Thank you and welcome, everyone. My name is Erica Robbins, and I work at the Lewin Group. Thank you for joining us today for the Care Transitions Toolkit for persons with mental health and co-occurring conditions, what it is and how you can use it. This webinar is supported through the Medicare Medicaid Coordination Office, MMCO, at the Centers for Medicare and Medicaid Services. MMCO is developing technical assistance and actionable item tools based on successful innovations and care models such as this webinar. To learn more about current efforts and resources, please visit resourcesforintegratedcare.com for more details. We will be posting a recording of this presentation, the slides, and the Q&A on our website within a few days. Please contact ric@lewin.com, which is ric@lewin.com, if you have any questions or additional comments. Before we get started, I'd like to remind you that all microphones will be muted throughout the presentation. However, there will be a question and answer opportunity at the end of the presentation. You can also use the Q&A icon on the web platform to submit questions. I would like to take a moment to mention a few housekeeping tips. If slides are not advancing, press F5. If you need closed captioning, see the CC icon at the bottom of the screen. At this time, I'd like to introduce our speakers. First, we have Gretchen Nye. She's a health insurance specialist with the Medicare Medicaid Coordination Office within the Centers for Medicare and Medicaid Services. We also have Paolo DeVecchio, who's the director of the Center for Mental Health Services within the Substance Abuse Mental Health Services Administration. We have Dr. Michael Hoagie here with us. He's a professor of psychiatry from Yale University. And we also have Betsy Dilla and Megan Alley. Both are research consultants with the Lewin Group. Effective care transitions, those important junctures between settings such as hospital to home or hospital to facility, are critical to quality care. Research reflects that ineffective care transition processes lead to adverse events that impact quality of life and increase cost. As a result, multiple federal and state agencies in partnership with local communities have developed and continue to refine care transition models with person-centered focus. Today, our speakers will be providing background on a new person-centered care transitions toolkit for persons with mental health and co-occurring conditions. They will highlight who can use the tool, how it can be used, and walk through the various sections. Additionally, there will be time at the end of the webinar for questions. So with that, let's go ahead and get started. Gretchen, can you begin to share some background on the development of the toolkit, please?
Sure. Thanks, Erica. We're really excited here and pleased with this toolkit. It's been over a year in the making with a lot of hard work from a wide range of contributors, including providers, beneficiaries, and federal and private subject matter experts. By way of background, this toolkit was developed, as Eric already mentioned, under a contract in the CMS Medicare Medicaid Coordination Office. And the purpose of this contract is to develop tools, trainings, and other resources for providers who care for dual-eligible beneficiaries, that is, beneficiaries who are eligible for both Medicare and Medicaid. As also mentioned, all of our resources, including this toolkit, are available at the website resourcesforintegratedcare.com, and we're always accepting feedback. We'd love to hear your feedback on both this webinar and the toolkit when you've had the opportunity to check it out for yourself, or if you've had the opportunity to use it with clients, please let us know how it goes. Please don't hesitate to reach out to the email ric@lewin.com. And we're also accepting comments on any of our other products available on that website. So as our commitment to continuous improvement under this contract, we're really open to any and all feedback. I'd like to thank SAMHSA for playing such an instrumental part in the development of this toolkit. The expertise and guidance from Paolo and his team was invaluable in the development of this resource, and we're really excited about it. I also wanted to thank the Lewin team for all of their hard work in developing all the various iterations and making sure we got it right, as well as all of our reviewers and testers, including Adam Anderson, Ellie Jazz, Michael Schroeder at the Ohio Department of Mental Health and Addiction Services, Sue Bergensen at Upton Behavioral Health, Michael Flaherty, a clinical and consulting psychologist in Pittsburgh, Terry Mabry Brown at the Northwest Ohio Psychiatric Hospital, Kathleen McCann at the National Association of Psychiatric Health Services, John Morris, the Executive Director of the Annapolis Coalition on Behavioral Health Workforce, Gail Stewart, Dean and Professor of the Medical University of South Carolina College of Nursing, and also our testers, representatives at Independent Case Management, Adaptive Illinois, and the Mental Health Association in Ulster County. And now to talk more about the toolkit itself, I was going to turn it over to Paulo, and he can give you some background and need.
Great. Thank you, Gretchen, and thank you for helping to lead this partnership between CMS, SAMHSA, and all of our partners. Also extend thanks as well to the Lewin Group and Dr. Hoagie at Yale. Like people with any serious healthcare conditions, people with serious mental illnesses want to get better. Mental health world, we call this recovery. In SAMHSA, we define recovery as a process, a change by which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. We know that far too many people with serious mental illness experience high rates of homelessness, unemployment, isolation, most regrettably, high rates of early mortality and comorbid health conditions. All these outcomes are preventable if we choose to take the steps needed to prevent them. That's why we're so excited about this potential toolkit. For people to recover, they need to be healthy, have access to ongoing medical treatments. They need a stable and safe place to live, have meaning and purpose in their lives, supportive relationships. We define these major components of recovery as health, home, purpose, and community. Care transitions bring challenges to all these components of recovery, but also opportunities. It's important for SAMHSA and CMS to support individuals going through this process to ensure it's successful and avoid unnecessarily needless negative outcomes. We know, for instance, that there's increased rates of suicide for individuals post-discharge. We also know we need to prevent ongoing readmissions, and we also need ongoing supports to people post-crisis situations. We know that individuals with mental health conditions often receive health care from different providers in different locations. Changing care locations as well as providers can be a difficult process. During this time, people receive services may need more support to reduce the risk of gaps or duplication in treatment and services, avoid errors and unnecessary increased costs, all of which can adversely impact a person's recovery. Further, people do not always have the information they need to make their transitions as seamless as possible. People need tools such as this toolkit to assist them during this time. By looking at the goals on slide 9 by looking at the goals for successful care transitions, we can find ways to increase opportunities to improve care transitions for people with mental health conditions. As a person moves from setting to setting or provider to provider while staying on their path to recovery, it's important that there are certain things in place to reach our goal of successful care transitions. Particularly 3 things as this slide indicates. First is clear communication with the person receiving services and their supporters and providers. Second is plans, ensuring that the person has a plan for follow-up appointments in a way that works best for them. And third is empowerment, ensuring that individuals are empowered, supported on their recovery journey, which includes reduction of symptoms and increasing the attainment of their identified life goals. And empowerment means being informed, and that's, again, where this particular tool can really help out a lot. By using person-centered planning principles as the foundation of this toolkit, it places the person in the driver's seat at the center of and as a partner in their planning and treatment process. The Care Transition Toolkit provides critical information and components to include in a roadmap aid in supporting successful care transitions that help a person to stay on their road to recovery. We're really excited about this potential tool to assist both individuals and families who may be experiencing mental health crises and care transitions. We feel it's a great tool also for providers that they can use with the individuals that they work with. I'm pleased now to turn it over to Dr. Michael Hoge, who will speak more about the purpose of the toolkit itself.
Thanks, Paolo. As you'll see displayed on the next slide, there are 4 specific objectives that have been identified in thinking about the purpose of this toolkit. The first is that it offers a fairly simple way to store information not only about treatments, medications, follow-up care, for example, but also for social and housing needs that individuals may have as they make the transition, particularly from more intensive levels of care back to community living. It's essentially a tool for thinking systematically about the essential information that any person in recovery and their family should sort of have at their fingertips. The second is that in thinking about all of this information, it really prompts individuals to assess what they know, what they have, and what they need. So, for example, thinking about questions such as, do I have follow-up care? Do I have follow-up care appointments? And will the services that have been arranged be sufficient to meet my needs? Asking those questions leads to the third function, which is prompting discussions between the individual receiving care, their care team, and other supportive individuals in their lives about these issues. The underlying questions here are, do we all have the same information? Are we on the same page about the care plan? These are critical questions, particularly at the time of transition. And then the fourth function is that the toolkit provides information and links about resources. The one cited here is advanced directives. There's also resources and links to things about peer support, money management, and employment, and other topics. I'd like to suggest a fifth purpose of the toolkit, which is that it can also be used by organizations that have existing documents that they use to capture this kind of information for persons in recovery at the time of transition, and use the model that's displayed here to strengthen existing tools or resources that they already have. So organizations can help persons in recovery find this resource and adopt this toolkit, or strengthen internal resources and documents that they already have. A final point that I would like to make about the purpose is that it was designed in the context of thinking about transitions in care, but the resource really has utility in an ongoing way to facilitate continuity and coordination of care, not just at the time of critical transitions. At this point in time, I'd like to turn it back to Erica to talk a little bit about using the toolkit.
Right, so who can use the toolkit and how? That's what we're going to talk about for a few minutes. If you can turn to the next slide, please. This toolkit was developed to support individuals with mental health and other co-occurring conditions. The purpose is to empower individuals to take control of their own health care. As a result, the toolkit includes tools to help individuals manage the transition between settings, even in cases where individuals may request support from others in their lives or even members of their care team. So it is possible for the tool to be used by care team members or supportive individuals, peer support, really anybody that the individual with mental health or co-occurring conditions would like to invite into support. And we want to take a moment to talk through a little terminology, because terminology does matter. Throughout the toolkit, we use words that may or may not be familiar to everyone involved in care transition activities. So as a result, we want to take a moment to highlight a few of these key terms. The first one is the term care transition. A care transition is when someone moves from one care provider to another or between one setting and another. It could be a care transition from home to hospital, from inpatient psychiatric or residential care facility, between providers, between facilities, or from facility to home. It could be any combination of factors. It's really that juncture between settings. We also use the term care team throughout the toolkit. When we use that term, we're referring to the staff who assist an individual to transition between locations. It may include nurses, primary care providers, psychologists, specialty counselors, care managers. Essentially, the individual with the mental health condition is the person in charge and the most important voice in the process. So nothing should be done to the individual, but rather should be done with the individual. So the care team is really that person's group of people to help support them through the transition activity. We also use the term supportive individual. When we use that term, we are referring to people who care about you and reach out to you when you need support. Some examples could be neighbors, your friends, peers, your landlord, pretty much anyone that's kind of in a supportive environment with that individual. And then the last term we want to mention is the term peer support. Peer support is someone who offers help based on shared experiences of living with mental health issues. This peer respects and empowers another person in a similar situation. The person respects and empowers the peer as well. They're part of an individual's care team and can also be a supportive individual. So these are the 4 common terms that you'll see throughout the toolkit, and these are included in the glossary along with some additional terms that you might want to take a look at. So what we'd like to do before we go forward is take a quick poll to try to get a feel for who we have on the phone, whether those of you on the phone fall into any of the categories that we were just talking through, whether you're a peer support, a member of a care team, a supported individual, or an individual that's actually gone through a care transition activity before. So if you could take a moment to review those responses and then just click Submit Answer once you've checked the box, and then we'll see who we have on the phone. We'll get a feel for that. All right, can we see what the results are, please? It looks like we have 2.1% are individuals who have experienced a transition between care settings, 5.7% supportive individual, 67.8% are part of a care team, and 2.1% of the persons on the phone are peer support individuals. So it's very helpful. Thank you for taking a moment to respond to that. So let's get back to the toolkit. Where can you find it? Well, you'll find the toolkit on the resourcesforintegratedcare.com website, and you'll see the link here on the slide. And in a few minutes, Megan and Betsy are going to kind of walk through each of the sections so you'll get a better feel for what's in the toolkit, but this is where you'll locate it. And then I want to talk a little bit about how you can use it. If you could go to the next slide. The toolkit was developed to meet unique circumstances. You can choose to print and manage transition on paper or save the file and manage your transition between settings electronically. You can also use all of the sections or only part, whatever helps you as you transition between settings. So it's meant to be very flexible. Mix and match, use all sections, print, copy, save, whatever makes sense to you. This is not a secure site, so it's not meant to be saved on the Resources for Integrated Care site. It's downloadable to your own share or your own personal drive so you can protect it for confidentiality purposes. So with that, I'd like to hand it off to Megan, and she's going to walk through some sections of the toolkit.
Thanks, Erica. As Erica said, my name is Megan Alley, and I work at the Lewin Group along with Erica and Betsy Dilla. And at this point, Betsy and I will walk through each tool of the toolkit so you can get a feel for which ones will be the most helpful in your specific situation. We do realize there are a lot of tools in this toolkit, so we created a Which Tools Do I Need page on this website. A screenshot is on this slide that you can see. You can ask yourself the questions on this page and then let them guide you to the appropriate tool that can help. For example, if you answer yes to the question, are you getting ready to move, you can check out the Care Transition Guide, and the link on that page will take you straight to that specific tool. If you prefer instead to see a full list of all of the tools available, the page called Download the Tools gives a brief description of each one. And on this page, you can choose the specific tools to either print out or download to your computer. So I'll be going through, starting with the first one, the introduction. We do encourage all users to at least read through the introduction. It gives a short explanation of the purpose of the toolkit, as well as a few key terms and definitions, which Erica went over just a moment ago. And as a reminder, a longer list of terms that we use in this toolkit and the definitions can be found on the glossary page of that toolkit. So first off, the Care Transition Guide provides 3 checklists. There's one for preparing to leave the hospital or other facility, and discussing the discharge plan with your care team. It also includes sections for understanding my medications and preparing to return home. The main idea behind this particular tool is to do 2 of the things that Michael Hoagie mentioned. First, to prompt the individual to assess what they know, what they have, and what they need, but also to bring up topics for discussion between the individual receiving care and their care team. The next tool is the Personal Health Record, and this is a way to keep all of your health information in one place. As a reminder, the Resources for Integrated Care website does not store any of your information. If you print this form out on paper or you download it to your computer and fill it out, please do keep it in a safe location that you would just like how you would treat other confidential health information or identity. Sections of the Personal Health Record cover things like your personal information, some emergency contacts and supportive individuals, things like your emergency contact's name, their phone number, and your relationship to them. And then the section Provider and Clinic and Hospital Information. So this offers a place to keep information like your clinic's address and phone number all in a handy location. The next tool is the Track Appointments. This is a place where you can organize information about the next appointments with your care team. So the first part, My Appointment Planner, gives space for lots of details, like the reason for this particular appointment and any questions that you might want to ask during it. The next one, My Appointment List, is shorter. If you like the more detailed version in the My Appointment Planner better from the previous slide, then by all means, please use that one. If this more streamlined version is more helpful, then go with this. Like Erica mentioned, this is just how the toolkit works. Don't feel like you have to use anything in here. Please just use what is helpful for you. The last part of this, the fellowship and peer support meetings. This is a place where you can keep track of any group meetings that you go to and the details for those. The next tool is called Medication Records. This is a place where you can keep information about all or any of the medications that you take. The first part, the My Individual Medications, is meant to be one form per medication where you can put lots of detail about each one, like side effects, what the pill looks like. The second part, My Medications by Time of Day, lets you create a schedule of when to take each medication, a little bit of a shorter, streamlined version. So again, please pick and choose which sections are helpful to you, and don't sweat the rest. I'll now turn things over to my colleague, Betsy Dilla, to go over the rest of the toolkit sections. All right, Betsy?
Thanks, Megan. So, the next one is crisis planning. This section has a spot for numbers that you can save to call in case of emergency or crisis, because we understand that transitioning between care settings can be stressful and it can trigger symptoms and feelings. So the purpose of this section is to help people identify coping mechanisms that they can lean upon and use when transitioning is stressful. The next section is living in the community. This one has 3 different tools to help people live at home. There's a checklist about information and resources that somebody might need. There's a tool where people can think and write about their strengths and coping skills. And then it has a tool identifying how to get the most out of peer support. This tool focuses on how you can use wellness to live a more meaningful life. The Living in the Community tool, here you can see the peer support tool that focuses on wellness. And this wellness is based on a SAMHSA definition of wellness. We wanted to really include information about peer support. Peer support, someone who offers help based on shared experiences of living with mental health issues. And a peer supporter respects and empowers someone else in a similar situation. So what this section has is more information about peer support and links to different national resources. Self-advocacy is an important part of someone taking their own lead in deciding what they want in their life. So this appendix gives tips on how to ask questions and find resources, focusing on satisfying the needs, preferences, and rights of an individual with mental health issues. Supportive individuals are still important in self-advocacy, but it's important for someone to stay at the center and involved in their own care plan. So this appendix has tips on how to advocate for yourself. Additional resources is section 7. This has, if you've read through the toolkit and you still want more information, here's where you can find it. There's links and phone numbers. Some of the different areas covered are financial assistance, employment, housing, and others. There's a list of national organizations that have resources for individuals with mental health conditions and their loved ones. Additionally, there's information about creating advanced healthcare directives. So now, we're going to do a quick poll. Now that we've gone over the different sections of the toolkit, what sections do you think you might use or you might recommend? Go ahead and click all that apply. We've got listed the Care Transition Guide, the Personal Health Record, Track Appointments, Medication Records, Crisis Planning, and Living in the Community. Which of these do you think would be most useful or most helpful in your life or in the life of others you support? Okay, we'll go ahead and share that. And you can see that it looks like a lot of you think that all of the tools would be useful. And that's great news. We're happy to see that. So we do hope that you will use these tools and you will recommend these tools. We had a question in the Q&A about if documents from the website are copyrighted or if they can be used in training materials and used with our Medicaid clients without permission. You can definitely use them with your clients. Please do. And you do not need further permission to use them with your clients. I'll let Erica speak to whether or not they can be used in training materials. Erica?
Sure. This is Erica. I would imagine it would be fine for them to be used throughout training materials. We had mentioned earlier about how you can take bits and pieces and parts of it and use it to meet the needs of people. I would lean on Gretchen to kind of confirm that that's comfortable with CMS to say, but I would think it would be okay. Gretchen, if you could unmute, do you have an opinion about whether it could be used through training materials?
Yeah, we provide the resources for Integrated Care website for this purpose. So whatever you want to use from that website, whether it be from this toolkit or anything else, please feel free to use it in training to fit whatever your needs are.
Great. It looks like we have some more questions, Betsy, in the chat box. Do you want to maybe help highlight some of them that we can answer?
Sure.
In the remaining amount of time that we have left, we're going to turn our attention to these questions. So feel free to continue to submit them if you have some questions as we're going through the remainder of our time here. And as a reminder, if you have a question, there are a few ways you can submit them. You can utilize the chat feature, or you can use our AT&T operator.
And actually, Erica, we have a question on, do you have any Arabic language forms? And I can go ahead and answer that. Unfortunately, at this time, the toolkit is only available in English. We're still can the data that are collected be used for research? So we're not actually collecting any data through the toolkit. The resources are available and people can enter information, but that will only be saved on their own computer. It will not be saved to the website, and we will not collect any information you enter into these forms. It's your private information, and please keep it in a secure place where you would keep other medical records. Erica, we have another question.
Great.
What is a co-occurring condition?
We use that term globally to refer to a secondary condition in addition to mental health. It could be a medical condition, a substance abuse condition. It could be really anything. It's about having a co-occurring condition with mental health. I don't know if there's anybody else who wants to weigh in on that, if there's a better way to describe it. Okay. Do we have any other questions?
Melanie, could you please describe how people can ask a question over the phone line?
Ladies and gentlemen, if you would like to ask a question, please press star then 1 on your touch-tone phone. A voice prompt on your phone line will indicate when your line has been opened. You may remove yourself from the queue at any time by pressing the star key followed by the digit 2. If you're using a speakerphone, please pick up the handset before pressing the corresponding digits. Once again, please press star 1 at this time. And we have no questions on the phone.
Erica, we have another question on the line, in the chat. And it says, do patients save the documents forms to their computers and then update them there, or do they have to re-download them from the site? And I can answer that one.
Okay.
They can re-update the versions that they have saved to their computer. That way that they can keep them updated, and there's no need for them to re-download a blank tool. Instead, they can update and use the information that's already included in their tool. And we have a few people looking for the address again of where they can find it and asking if a copy is available. Please go ahead and download from www.resourcesforintegratedcare.com, and that address is showing on the slides. Erica, here's another question for you. Will this toolkit be updated from time to time?
I think it's possible that it may at some point, but we don't really have a timeline at this moment. I do think that a lot of the components that are included in the tools are timeless to a degree. They're not things that would change in terms of what you would include or not include from a content perspective. What's different or what will change is what people enter. So I think if we learn more going forward about what helps individuals to manage care between settings, then of course we may add new sections or new rows or new sentences, but for the most part we did a lot of research and gathered a lot of feedback from many subject matter experts, and we feel like we've got a pretty good understanding of what should be included in at least this first initial draft round of it.
Someone asked, is it correct to assume this tool can be used for adolescents as well?
I would think it could be used for any age.
Someone asked, does the Massachusetts Department of Mental Health use this currently? This toolkit is brand new. It's being launched through this webinar. And so currently no one's using it, but we hope you will all take it out to your clients and consider using it in your different organizations. Someone asked, are there browser requirements? No, they are downloaded as fillable PDFs, and they should work with any browser. A copy of the PowerPoint will be available on the Resources for Integrated Care website, as will a recording of this webinar. Someone asked you make this a part of the workflow during follow-up visits. Please bring your tools for us to review. And how you want to use the tools really can be based, and Erica, please elaborate on this, but can really be based on what works best for your clients and for your organization. We don't have a designated way to use it. We do encourage people to focus on the sections that are most useful to them. The toolkit as a whole, we got feedback that it can be somewhat overwhelming, but that individual pieces can be really helpful. Please don't see this toolkit as a burden. We hope that you'll see it as a tool to help improve communication and improve people's lives and their ability to plan their own care. Erica, do you want to expand?
No, I think that's very good. I think it is meant to be flexible. Take the sections you want to take, modify them, pull down. If you don't want to do the whole thing, you don't have to do the whole thing. If you only like the medication section, then use that section. If you're a provider and you have a tool that's similar, you could do a comparison of your tool against this, see if there's anything missing in your tool that maybe you want to amplify or expand on, and kind of pull that in. Or you may choose not to do that at all. So it's really meant to give you another option out there based on research in the care transitions field of what works and what helps. And that's kind of what resulted in this existing version. So it's meant to be flexible. And we hope that people feel comfortable kind of pulling what they need out of it.
Speaking of flexibility, someone asked, how do people update if they are accessing from a public computer, for example, at the library? So one option would be to actually just print it out on paper, and then you can update the paper version. Also, if you have clients who don't have access to a computer and you can't get them to a publicly shared computer, please feel free to download it and use it as a paper version. Somebody asked, is your company local, Ohio, national, or international? How do you anticipate this toolkit being distributed?
This toolkit will be distributed through the Resources for IntegratedCare.com website. And so anyone who has access to the computer can pull down the tool or sections of the tool as they wish. Operator, do we have any questions that have come through?
Yes, we'll go to our first questioner.
Yes. I have a question. The website is not coming up. The www.resourcesforintegratedcare.com. I've tried it a few times and it said website does not, work or whatever. So I don't know why it's not working. But anyhow, thanks.
Yeah, it should be resourcesforintegratedcare.com. So if you click on that, you should find the toolkit. And if you did a Google search, you would find it that way too. If you typed in Care Transitions Toolkit for persons with mental health and co-occurring conditions, you'll see it pop up there too. You'll find the same website.
We have I can try Google it. For some reason, I don't know, it's not coming up.
Thank you for alerting us to this issue. We're hearing in the chat that at least one other person had issues as well, but it did let her in.
Okay, now I did it through Google, and then it's coming up that way, I think.
Okay, good. Yeah, we'll double check that to make sure that there's not some glitch in that link.
Yeah,
okay.
That's what it just, I don't know why. It's weird.
It is weird.
Okay, well, thank you.
You're welcome.
And we have no other questions at this time.
Great.
There's a question. Is there a fee to use the toolkit? And no, it is publicly available online. Please use it. Please send it to anyone else you think might want to use it. We really encourage everyone to share it and use it. There is no fee. If anyone suggests you need to pay a fee, please report them to us so we can follow up, because there is no fee. Somebody asked, I was able to find the toolkit. Please confirm this tool is to be used mainly by the client or provider. Erica, Michael?
Yes, this is Erica. The tool was developed for the individual with mental health conditions, but also with the thought in mind that some individuals may ask their care team or their peer support or a family member, which we term supportive individual, to kind of help them along, because we know that sometimes it helps to have that support. So we kind of kept that in mind, but just know the toolkit was developed with the individual really in mind. And so the language is really uses the term you a lot because it's really speaking to the person with the mental health condition. I don't know, Michael, if you want to add more to that or not.
No, I think that's exactly right. It's really intended primarily for people in recovery, but I would agree that at times family members or significant others may sort of help in the collection and storing of important information, and that may particularly occur at times where someone is receiving acute care, such as hospital care, and may need that additional assistance. But as always, the rights to that information that belongs to the individual, and it's up to them to decide who they would like to assist them or have the information.
Great. Are there any other questions, operator, on your end?
We have no other questions.
Great. Betsy, any more questions in the chat box?
Someone did indicate that if you include the https:// portion, it's more likely to let you into the website. On your screen, you'll see a survey link. It is currently open. We are still taking questions, but if you would like to click on that link and provide input and feedback on what you got out of this webinar and your feelings on it, we will use that to improve our future webinars.
And I see another comment in here from someone asking how they can provide feedback on the tool. As Gretchen Nye from CMS had mentioned earlier in the call, we're always open. CMS is very much open to any feedback that anyone has, and that's why we have an email address. And so you'll notice on the last slide, or it might have been on the slide prior, there was an email, ric@lewin.com. So if you have feedback on the tool or any other comments or helpful guidance for CMS as it relates to integrated care, feel free to send an email. We're always open to hearing the good and the bad that you might feel.
Someone also asked if we are planning to update this toolkit in the future.
At this present time, there's not a plan to update, but that doesn't mean that we won't develop a plan in the future. So if you have feedback, feel free to share it, and at some point in the future, hopefully there'll be an opportunity to continue to add to the tool and make it stronger as we go forward and as we learn more about care transition activity and what works and doesn't work.
Someone asked, are there research articles utilizing these tools available for listeners to reference?
There are multiple research studies that have been done on care transitions. And if you did a Google search, you would find all kinds of things. And many of these research articles were actually used to kind of identify the elements to include in the tool. And so some of these things are included in the resource sections of the tool. And certainly if you want additional references, if you go to the website where you see the Care Transitions Toolkit, you could click on references and you could pull up a whole host of resources and references that were used to build the tool. And so there's lots and lots of information out there on this topic area. Any other questions?
I'm skimming
Yeah, me
through.
too. Make sure I didn't miss any.
Someone asked, from where did the original Care Transitions template come from?
Are you referring to the section, the Care Transitions section?
The question just said, where did the original Care Transitions template come from?
Without knowing whether you're referring to Section 1 or the entire document, I could tell you that there's a companion document or one that's similar, parallel to this one for individuals with developmental disabilities. And so that particular toolkit was used as a foundation to this one and then adapted to better meet the needs of persons with mental health conditions. And so if there's a template, I guess I would go back to that one. But again, both that original toolkit for persons with developmental disabilities as well as this toolkit for persons with mental health were developed based on the research out there on care transitions generally. And again, those are included in the references that are posted on the website.
This is Megan. We have a question that came in that's asked, how can we provide feedback on this tool?
Yeah, and I had mentioned earlier that if you have feedback on the tool, feel free to send an email to ric@lewin.com, and we're happy to take that feedback, and if there are changes needed, then we can talk with CMS about updates at some point in the future, if needed. All right, again, please take a moment to complete the survey to help inform our future events, and you'll see the link here on the screen for the survey. Your feedback on how we do webinars is also critically important, so we welcome that feedback, both good and bad. And as a reminder, if you have questions or comments, please email ric@lewin.com, and that's LEWIN.com. The slides from today's presentation, a recording, and a transcript will be available on the Resources for IntegratedCare.com website. And we hope you have a wonderful afternoon. And if we don't have any other questions, we'll let people go a few minutes early.
It does sound like a few people are having difficulty submitting the survey.
Okay.
And I think that's just because we haven't finished the webinar. But as soon as we close out the webinar, you should be able to complete the survey.
Great. We'll leave that pulled up there.
Someone did ask if we'll be sending a reminder email with the address and link to access the toolkit.
Yes, we can do that. We can send out a reminder to registrants after the webinar.
We will send an email to all registrants, including a direct link to the toolkit, as well as information on who you can email with further feedback or questions. Melanie, are there any other questions on the phone?
We have none on the phone.
All right. Gretchen or Paulo, Michael, any final comments on your end before we close?
No, thank you.
No, none here.
All right. Well, we thank you so much for joining our webinar, and we hope that this information is helpful. We wish you all a wonderful afternoon, and thank you for participating. This concludes the webinar. Thank you.
That does conclude our conference for today. Thank you for your participation and for using AT&T Teleconference Service. You may now disconnect. Ladies and gentlemen, thank you for standing by. Welcome to the webinar for the Care Transition Toolkit for persons with mental health co-occurring conditions. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Instructions will be given at that time. If you should require assistance during the call, please press star then 0. This call is being recorded. I would now like to turn the webinar over to Erica Robbins. Please go ahead.
Thank you. Thank you and welcome, everyone. My name is Erica Robbins, and I work at the Lewin Group. Thank you for joining us today for the Care Transitions Toolkit for persons